So sorry, just got to do that. So thanks, Erin. So right to begin with, we're going to have Erin McFarland from Healthy Aging Alberta. She's just going to do a little bit of introduction to Healthy Aging Alberta and some of the things that are going on uh, as of this point. So Erin, take it away.
Thank you so much, Amanda. Can you hear me okay? I just want to make sure my volume. Yep. Okay. So as Amanda mentioned, my name is Erin. I am the Digital Engagement Coordinator with Healthy Aging Alberta. I'm just going to speak briefly on behalf of Healthy Aging Alberta as we're one of the hosts of this event. And I'm kind of sick, so my voice is cracking a little bit. If you're not already familiar, Healthy Aging Alberta is a network of community-based senior serving organizations and allies across the province, united by the shared vision to make Alberta one of the best places in the world to grow older. We exist to build connections and capacity within the sector and also to work to link the sector with other systems such as health and housing. Organizations, as you probably know, serving older adults with non-medical community supports play a critical role in Albertans aging in their own homes or aging in community. And so the belief is that coordinating our efforts and having a united voice is critical to meeting the needs of this growing demographic. Healthy Aging Alberta is backboned by the United Way of Calgary and area, and the United Way and the government of Alberta have worked really closely together in the development of this initiative. And next slide, please. And so one of the ways that we do this is through CORE Alberta, and CORE stands for Collaborative Online Resources and Education. If you're not already a member, and a member just simply means you're a user, you've signed up for free to the site. But it's a member-based digital knowledge and learning platform, and it really functions as a communications and a content sharing tool, a capacity building tool, and a collaboration tool, allowing members or users to access resources and collaborate with others who have aligned mandates. So overall, really contributing in one way to the network and sector building goals and the vision of Healthy Aging Alberta. So again, if you're not already a member with us, you're welcome to head over to CORE Alberta, sign up, and you can post your own events and news items and funding opportunities and resources as well to share with the sector. I'll also just quickly say that Healthy Aging Alberta has a regional community development approach. So we have regional community developers working across the province. And if you ever want to connect more within your region, just get in touch and we'll connect you in that way. Next slide, please. And one thing that we have on CORE Alberta are core groups who collaborate around certain topics and host events like this one. And so one of our groups is the Elder Abuse group. So you're welcome to head over there to the groups section on CORE Alberta and join the group to stay up to date. And I don't know if there's anything else you want to say, Amanda, about the group, but I'm going to maybe leave it at that for now and hand it back over to you.
Super. Thanks so much, Erin. So we'll just get right into it. So I think just to let you know that it'll be about 45, 50-minute presentation. And then, like I said, you're welcome to ask questions without, but we will have a time also for discussion, hopefully about 20, 25 minutes. So you're welcome to stay for that as well. So today, what we're looking at is for our agenda is we're going to talk about 4 key pieces, our awareness, our prevention, our intervention, and our moving forward. So we each have a few slides that we're going to present to you. Just to mention as well, there was a couple of questions in the registration, so hopefully we can answer those questions for you. And if there are any, we'll have a slide that will have all of the resources at the end. So you're welcome to connect with those resources as well. But yeah, that's how we're going to be doing it today. So we'll go for it. So awareness, that's what I'm going to be speaking about this morning or this afternoon, pardon me. And so the first one that we wanted to talk about is something that we have June 15th is World Elder Abuse Awareness Day. And the WEAD was launched of June 15th of 2006 by the International Network for Prevention of Elder Abuse and the World Health Organization at the United Nations. WEAD is also in support, sorry, of the United Nations International Plan of Action acknowledging the significance of elder abuse as a public health and human rights issue. Since its inception, communities throughout the country and around the world use this day to raise the visibility of elder abuse by sharing information about abuse and neglect and promoting the resources and services that increase senior safety and well-being. The WIAD represents the one day in the year when the whole world voices its opposition to the abuse, violence, and suffering inflicted on older adults in our communities. The Alberta Elder Abuse Awareness Council website has developed a toolkit that is available to anyone that would like to plan an event or bring awareness to your community. There are photos, postcards, poster templates, web banners, Zoom backgrounds, an awareness guide, and a fillable media and proclamation verbiage. And you are welcome. Those are for you to use as you see fit. So that's that day. It's always June 15th every year. And so the good thing about that is the one thing that we have developed through the Alberta Elder Abuse Awareness Council is the grow the conversation. So that's important for us in our region across Alberta of this just continuing to talk about and bring awareness of older adult abuse. So one of the things that we do for our awareness piece is a workshop called Taking Action Against Elder Abuse. It's a full day workshop and it examines the issues of elder abuse and it outlines various ways in which frontline staff may respond to suspected cases. It clarifies expectations of frontline staff, discusses approaches that have found to be useful in recognizing and responding to potential and ongoing situations. It acknowledges in depth the complexities surrounding abuse, and it outlines approaches to risk assessment in order to ensure consistent, effective, and professional responses to specific incidents of abuse. So I know a few of our folks today joining are from the from Alberta Health Services, and this is something that it is for direct frontline staff that work with older adults perhaps on a daily basis. And so this gives you a real insight to what you can do as a frontline staff to help your patients or if you're working with those folks that may need it. So it's a really good program and it's offered by the Alberta Elder Abuse Awareness Council. And so definitely if that's something you're interested in, you can check out the website and see when there will be another workshop going on for that one. We also have an awareness presentation called It's Not Right for Neighbors, Friends, and Families for Older Adults. This is for anybody to engage bystanders of all ages everywhere to know the warning signs of elder abuse and what you as a neighbor, friend, or family member can do. This particular program originates out of Ontario and is included in the National Training for Elder Abuse Leaders and Experts so that they could hold presentations in their own regions and communities. So basically this it's about an hour and a half. We can tailor it to what your particular group or committee is looking for interest and what you would like to find out about this presentation. But basically what we're going to talk about is the warning signs of abuse, a big piece of what ageism is and how it plays in abuse. And the important thing of this one, I think we want to point out is that it is, we all have ageist attitudes. And so it's really a way for us to just look within ourselves as well as just, most of us have friends, family, neighbors that we could possibly be looking out for. We also talk about the impact of the abusive behavior. And one of the things that is a really important part of this presentation is how to respond safely and supportively. So as a neighbor, friend, or family of an older adult, there's a conversation that can be had. And so that's what we would be talking about, is how to do that safely and supportively so that we're always looking out for our older adult and not adding stress or any negative pieces that may contribute. And one of the big things we always talk about is you power. And you power is about all of us making a difference and sharing in the goal that older adult has to live with abuse. And that's our biggest talk about the conversations. We also do have videos with scenarios of different things that happen, and how we can talk in a supportive way, and then it shows how we can be not so supportive. So they're a great tool to give real life, how do you say, real life perspective of what is happening to possibly to somebody that you may know, that helps in that awareness piece and how to do that. And then we have a piece that we talk about, and we will share it here, of the supports that we have, so that there will be a slide at the end that shows the resources that you can get in contact if you know somebody or have any questions. So that's that one. And here are just a little bit of an information on the Taking Action Against Elder Abuse, the workshop, and then the bystander training. So we look at the bystander is for everybody of all ages, for youth and up. And like I said, the presentations can be tailored to what your needs are. And we also always welcome anybody that be interested in taking a train the presenter session, so that you could do this in your own community or when you're within your own organization, if you would like to be that, because there's always a changing of staff and stuff like that. So this might be something that you might be interested in doing for your particular group or agency that you're working for. We also have on the Alberta Elder Abuse Awareness Council is a handbook that was created to provide older adults with important information to help them stay safe. It is a comprehensive guide that can help older adults identify an unsafe or abusive situation and understand their rights and options if someone in their life is hurting them. Because each individual situation is different and complex, this handbook contains a variety of resources that provide lots of information to connect people to organizations and experts that can help navigate the unique situation. So this is available to be downloaded on the AEAAC website, and we will be sharing that website with you at a later date. But just know that that is something that you can share with folks that maybe needing that help. I think the really good thing about this is it explains a lot about our seniors' rights, and it gives things to think about. It tells where to get help with different issues, which there are lots of different issues that could come up with a senior or an older adult, so that there's a comprehensive guide for that, and as well as valuable resources throughout Alberta on where to get help. So really good resource. So now I'm going to hand it over for the next piece, which is prevention piece, and Charlene Satar will be taking that over for us. And Charlene, would you like to take it away?
Sure, thanks, Amanda, and I'll get you to the advance the slides for me when I ask.
Sure.
Thank you. So hi, everybody. I'm Charlene Satar. I work out of the FCSS office in Hinton. I am the Elder Abuse Supports Navigator for Hinton, Edson, and Yellowhead County area, and I've been working in the field of elder abuse prevention and response for the last 8 years. So really happy to be a part of this presentation today. To prevent elder abuse, we really must understand and address the factors that put people at risk of violence. And so one of the things that we've come to understand in the broader world of family violence is that adopting strategies for primary prevention and that upstream models of prevention is really important going forward. It's much more difficult to address situations of family of violence once they're embedded within that family situation, within that intimate partner relationship. If we can address situations or primary prevention issues upstream, then we stand a better risk of preventing the abuse from happening in the first place. So if you look at programs like SAGES, which is a wonderful organization out of Calgary, who does a lot of primary prevention programming, and they're looking at tackling systemic and societal causes of domestic violence, primarily through helping men and boys understand the impact that they have on creating change in having conversations and for them to be part of the conversation about addressing violence. As well, another organization called SHIFT, and you can certainly look both of these organizations and movements up online. SHIFT also takes a primary prevention approach to changing societal norms and behaviors that reinforce violence in our society. And so if we look at these models of preventative and upstream prevention in relation to elder abuse, what we really want to we want to take those models that they use for that gender-based violence, but also keep in mind the age-based violence that we see. And so that comes in the form of ageist attitudes, which I'm going to talk about a little bit broader in one of the next slides. But going upstream and trying to figure out why we have the issue of elder abuse in the first place is really the model that we want to try and adopt when we're looking at prevention. As well, caregiver support programming is really important in that as a preventative tool. So tapping into resources from the Alzheimer's Society of Alberta and also Caregivers Alberta, looking for ways in community that we can support caregivers. I prefer the term care partner, and that's something that I've come to adopt through my work with the Alzheimer's Society as well. I've been running a care partner support group in my community for 7 years. The term care partner, just using that language alone, indicates that people who are coming up alongside of older adults in community or in their family are partnering with that older adult. They're not giving, and the senior is not taking. They're partnering with the older adult. So even just shifts in language are important as we look at preventative measures going forward. And one of the quotes that I heard from a wonderful young man by the name of Trevor Williams through a men's engagement workshop recently was, "When you're not well, you can do harm." And I think if we can help people who are within the care partnering world of older adults, whether that's adult children, whether that's spouses, whether that's neighbors, friends, or family members, whether they're male or female, we all have to understand that when we're not well emotionally or with our mental health, we can do harm out of frustration and perhaps not feeling well ourselves. So really addressing that preventative process, making sure that the care partners are well in this prevention process too. So next slide, Amanda. The other thing that we've come to understand as a best practice as far as prevention tools go is helping to build healthy relationships between adult children and parents. And the reverse is true as well, helping to build the relationship between parents and their adult children. We've come to understand that as a preventative measure, if we can help older adults understand some of the things that put situations of conflict in motion, such as lack of good communication skills, for sure boundaries, what a boundary is in the context of a family environment. We've come to understand that baby boomers or people of the silent generation we were really never taught about boundaries and what boundaries are, beyond the fact that they create a boundary between provinces or countries. But those personal boundaries, we have not really had an opportunity to learn about. So this can be a real shift for older adults to understand where boundaries need to be set for older adult children or care partners, as well as what boundaries the adult children might have to put in place as well when journeying through this process of aging within family. Understanding family dynamics can be really important in helping all of us understand how to prevent potential abuse situations from coming to fruition. And if we can understand family dynamics and some of the family history and how the people within that family understand how their past history can impact what's going on now, those can all be preventative tools as well. And Amanda had mentioned the rights of parents of adult children. This is something that is really quite new. A thought process is that older adults have never really been educated on what their rights are. And I think we have to be really cognizant of what that looks like within cultures as well. And so we have to do a better job listening to older adults as well as their care partners and helping us understand what their needs are as far as family dynamics go as well, and use those insights as preventative steps in preventing mistreatment. Go ahead, Amanda. Thank you. So Amanda also mentioned about ageism in the It's Not Right workshops, which is a wonderful workshop, and I encourage everyone to take it. We have to tackle ageism in our society, and not just, the ageist attitudes that we see other people have, but also sitting with ourselves and understanding what our own biases are as far as how we feel about the aging process, even within ourselves. And so we tend to think that ageism is something other people do, but we have to really, even as support workers and people on the front lines, we have to address our own ageist attitudes so that we don't bring those attitudes into our navigation of supports for older adults. So if we can tackle ageism and help society have a better understanding of the aging process and understand that aging is not a disease, it's a natural progression of life, and also, again, having an understanding of what the cultural roles are within the attitudes of aging. Again, listening to families, listening to individuals about what aging looks like and feels like, and understanding that while we understand that frailty can add to the vulnerability of aging people, it is not a guarantee for abuse. So really working on that empowerment of people as we age to break through the stereotypes of aging is a wonderful preventative tool and something that we have to get better at. The other thing I wanted to just mention quickly is compassionate ageism. And again, addressing our own perceptions of ageism and not reinforcing the fear that we tend to associate with aging, and wanting to rescue people from the aging process. So this all takes time, and this all takes a real concerted effort to listen to the people who are aging in our society and addressing our own stereotypes. Go ahead, Amanda. And then, of course, we want to talk briefly about advanced care planning. And the Speak Up program is really has a lot of really good information in it about advanced care planning. And one of the things they say, 100% of Canadians will die. We're all going to pass away at some point. And it's interesting that so few people have taken thought to advanced care planning. I just had a client in this morning whose wife has been diagnosed with dementia, vascular dementia due to a stroke. And unfortunately, she went through that and has been diagnosed before they were ever able to put that advanced care planning into place. It's created a lot of conflict within the family. So having these conversations with clients, with our neighbors, with our friends, with our family members about power of attorney documents, about personal directive documents, and making sure that these documents are understood by the people who are signing them, as well as the people who are stepping up to be the attorneys within these documents, is really, really important. Conversations certainly around balancing the desires of the older adult, what their desires for care are, what their expectations of care are, versus the capacity of the caregivers or care partners that they've chosen as their decision makers, making sure that everyone's on the same page. And we're not very good about having those really open conversations about death and dying and planning. Talking about it doesn't make it happen. And so we have to work really hard with respect to that and helping people, again, taking into consideration cultural aspects of the clients that we might provide support for. And then we're seeing a growing number of people who do not have family support systems, a growing number of people who are estranged from family members, or maybe they've never had children, they've never been married. What does advanced care planning look like for those folks as well? So these things are all preventative tools that we can work harder at to try and mitigate the potential for abuse with older adults in our society. Thanks, Amanda. Does anybody have any questions?
You're free to speak up if you do. Please, we welcome it. Thank you, Charlene. I appreciate that great information. So now we're going to do the intervention part. Joanne, that's you, correct?
That's me.
All right. Joanne, take it away.
Thanks. So my name is Joanne Blinko, and I am the Acting Executive Director for the Alberta Elder Abuse Awareness Council. I'm a social worker, and I have been in the field of abuse now for 38 years. The first 30 years as a child protection worker, and the last 8 years in elder abuse. Half of that time, so 4 of those years, I did frontline case management here in Lethbridge, where I am located. When we look at intervention, one of the pieces that we have to look at is public awareness. So currently there's a prevalence study that is underway. In 2015, Brittany will explain more of it, we started the prevalence study, and now we're moving forward, being able to examine where we're at now. So the piece that's the big one is, how has the awareness changed? How is the public more aware that elder abuse exists in our communities? And not just specifically in the area of an older adult who has experienced abuse, but elder abuse is everyone's business. Amanda described some of the programs like the NFF-INR, where it's bystander training. Charlene talked about the prevention pieces. The big picture of this is making sure that the community, the public, people across the province are aware that elder abuse exists in our communities. Currently, the government is working on an awareness campaign. So if you want to go to their website, you'll be able to look for things, hopefully in your community, that are occurring in the month of November. The other thing with the education piece is letting older adults know that there are services that exist in communities across the province. So do you want to go to the next slide, Amanda? So what we are talking about when we talk about services is a coordinated community response, which exists having a case manager and service providers to be able to deal with the situations of elder abuse collectively. Next one. So coordinated community response, what they are. So in 2014, the government put out a proposal to have communities come together and create a coordinated community response team. And so in 2015 until 2018, there were 30 communities across the province that were funded to develop a coordinated community response. And in those communities, there was a coordinator, and they were the centerpiece to be able to bring together a collective group of people who work with older adults in the community. These CCRs are wraparound services, and they provide supports to older adults that are experiencing abuse. And each one of these CCRs across the community are specific to that community. So, for example, Charlene in Hinton has a CCR community, and in that community, those are the people who come together to be able to provide supports to older adults who are having situations where they might be experiencing elder abuse. It's a collective team coming together to provide supports. The other thing that's most important when we talk about CCRs, case managers, and service providers is the older adults determine the services that they need and that they want. They are defining what that bus is going to look like and what additional services they want to come along with them. If people are interested in developing a coordinated community response, in 2019, there was a toolkit that was developed that was the example of what a coordinated community response was. So taking those existing that were in place from 2015 to 2018, they assisted in that toolbox of describing what they saw was useful in bringing those teams together. Next one, Amanda. So case managers. So we've had the coordinated community responses from 2015 to 2018. And then in 2021, what was included was a case manager. So between August of 2021 till July of 2022 was the first year that we had grant funding that included case managers being able to provide supports specifically to the situations of elder abuse. We got subsequent grant funding another year later, which we have just finished. It's called the Recovery Oriented System of Care. So in that ROS grant funding, the additional piece that came through is looking at the pieces around mental health and addiction, both for family and the alleged offender. So case managers, coordinated community response teams were being able to provide supports to the older adult who was experiencing abuse, but also provide referrals and resources to the alleged offender during that time. What we've just started now with is our 3-year grant funding. So collective with our membership across the province, the people who have been working hard in the field of elder abuse, we were able to get sustainable funding from the government for the next 3 years. We've just started that grant funding. So this year we've got 13 communities. The hope is, and we've started that process, April of next year and April the year after, we're hoping to include 5 new communities, coordinated community response communities with a case manager, with supports and collectiveness from service providers to be able to provide supports to older adults who are experiencing elder abuse. Next slide, Amanda. So case managers walk with the older adult. They are helping and they are supporting them, and they are accessing the resources in their community. And I think that's one of the biggest things that CCR stand for, is that multidisciplinary team. So a case manager who is providing supports to an older adult, knowing what the issues or the concerns that they want, are able to immediately access that support, well, sometimes not immediately, but within a period of time, to access that support for an older adult. Case managers were practicing what's called a casework practice model, so that across the province, we have a standard of practice, so that whether you're up north or down south, that there's the same method of providing services for the older adult and getting the supports that they are asking for. The other thing that we have been able to do is, since getting the 3-year funding is, and I think, Amanda, you described the INR NFF, so it's not right, neighbors, friends, and family. There's a community of practice meeting that occurs once every 2 months that brings collectively together anybody who's doing a presentation on INR, and it's a way of seeing if there are trends, do we need to change material. It is honing into being able to do the best we can to provide that bystander training. The other thing that happens as part of my role is just to have meetings with case managers, and that's bringing them together to talk about what's happening in communities, how are things going, where's the casework practice model fit with regards to things, what are the trends that we're seeing. And also at times we invite the new CCRs, people who are interested. Can you go back one for me? People who are interested in being able to set up a coordinated community response. As I said, that it was important that we start adding those coordinated community responses so that eventually any older adult experiencing any level of abuse would have the supports that they need that would be right across the province. Sorry, next one. There we are. The other thing we do is open case conferencing. So the first and the third Tuesday of the month, we provide a forum where case managers, coordinated community responses, people in community who are providing services to older adults who are experiencing abuse can come together and case conference on specifics around ideas, strategies, just a way to brainstorm things that are happening, and could they get the support of the team. The other thing that we have is by invitation, we've got those coordinated community response groups coming together once a month to talk about what the standard of practice is going to look like. So in 2015 to 2018, those CCRs were developed. We added a case manager person. We're going to, over the next 2 years, additionally build 10 new communities. So what we're looking at is putting together what is their perception about what a CCR needs to look like and what are those foundational pieces of practice and how that will work. Next one. That would be you, Brittany, or you want to take it from here?
Yeah, sure. Thanks, Joanne. So this slide here just highlights one of our additional trainings that we offer through the Elder Abuse Council. The Strangulation Identification Workshop provides participants with the understanding and knowledge of strangulation related to domestic violence, how to identify a victim of strangulation, the mechanism of injury, signs and symptoms, short and long-term physical and cognitive health implications. Morag McLean is a registered nurse who is from Edmonton, and she is our group facilitator for this half-day workshop throughout the province. Next slide. Thank you. Now I will begin my section of moving forward. So I am the chair of the AEAAC board, and I am also the senior services supervisor here at the town of Sylvan Lake with our FCSS department. And I will be speaking to the next steps of what we could see in the near future. So people are continuing to live longer than ever before, yet for many, these additional years may not be their greatest. In 2015, the average life expectancy for Canadians aged 60 to 64 was 24.6 years. That would put them at their maximum age of ranging between 84 and 88 years old. What can we change about this? What can we do now that will change this for the aging population? Could it increase in prevention? How about things such as intergenerational activities, combating ageism like Charlene previously spoke to, accessing to safe, inclusive spaces? What does safety and security look like as we grow old? Meaningful work in our retirement years? What is staying active to you and to those that we support? Resiliency, connections instead of isolation, And what do we need to do for those who have lived with high medical or cognitive conditions since they came to be on Earth? What can we do now to ensure that generations here today and to come live their lives with optimum quality of life, free of abuse, living in their chosen community? Next slide, please. These are kind of highlighting the key areas that I will be speaking to briefly. We can go to the next slide. The next two slides are a stat review from our case managers in the 2022 year. The key highlights that are takeaways from these two graphics are the most common types of abuse are emotional and financial. Nearly 1 out of 2 cases reported financial concerns as a contributing factor for the perpetrator, as well as almost half having a sense of entitlement. Being their child is not an entitlement to have abuse. 3 out of 4 had mental health and or addictions. And even further than that, 6 out of 10 older adults also had addiction or mental health concerns themselves. 73% of seniors accessing supports of elder abuse for the first time. Increased awareness is still needed, with less than 1 out of 3 elder abuse cases were self-reported. Crucial training such as our INR, Neighbors, Friends, and Family, is delivered through the province. 32 of elder abuse reporting. 32% of the cases of elder abuse last year were reported by those neighbors, friends, and family. So we have great training out there. We need to continue that movement up and get more people trained throughout the province, and hopefully we will see more cases of elder abuse having been reported and accessing some supports. You can go to the next slide so they can see that one. Thank you. 85% reported cases the older adult was living in their own community. 70% of survivors were single, divorced, separated, or widowed, therefore indicating a greater dependence on family or friends. Top 4 contributing factors for perpetrators: financial concerns, entitlement, mental health, and addictions. Top 4 vulnerabilities for older adults experiencing abuse was transportation, how they get to and from places, their income, and their own physical or cognitive health. Next slide, please. Joanne, would you like to start this slide off?
What Brittany and I were chatting about is that when the government was putting together these 5 strategies, they did involve civil community groups. They involved members of the council, that they went and they sought out information and took a look at what are the needs within the community and identified with their own knowledge and the support from the community what they thought was the highlights in terms of what was needed to be able to address the issue of elder abuse. We had also talked about how we align our work as the Alberta Elder Abuse Awareness Council with these strategies and see it as a collective moving forward to address the issue of elder abuse in a most collective way that we possibly can.
Thanks, Joanne. So out of this new strategy came a new elder abuse definition. So in the strategy, it now reads, elder abuse is any intentional or reckless act or willful and negligent disregard occurring within a relationship of family, trust, or dependency directed at someone 65 years of age or older that causes physical, emotional, or psychological harm, involves the misappropriation or misuse of money or other personal possessions for personal or real property, subjects an individual to non-consensual sexual contact, activity, or behavior, or elder abuse is failure to provide the necessities of life. Along with the new definition, brought 5 goals. The first goal is to improve awareness. So knowledge opportunities out of this awareness piece is through CORE here today, the AEAAC, and the support of our community organizations throughout the province. All all people in Alberta know what elder abuse is and how to prevent, identify, and know how to access various supports and how to recognize abuse and where to go for support. Where to go for support. There is a slide here at the end, but just a couple highlights are the AEAAC website, to your case manager in your community or your CCR, or to a community organization who may work with abuse. We have 211, and then of course the 310-1818 for our family violence info line. Goal number 2 is skilled service providers. Service providers have the skills and knowledge needed to serve and support older adults to help prevent, identify, and address abuse appropriately. Proper training, skills, and education, expertise, and resources to take action and prevent abuse. And older adults are a diverse, unique, and sometimes have complex needs. So there needs to be community collaboration in order to adequately serve these individuals. Through the education, training, and improved awareness, there's access to training that is offered throughout the province, and that everybody has access to the exact same training. Goal number 3, community coordinated responses. So throughout the province, there are communities with CCRs that are connected and prepared to work with one another to provide the support needed to the older adult, and furthermore, to hopefully prevent elder abuse and respond to it. Collaboration partnership among these community organizations is imperative for supporting, preventing, identifying, and responding to elder abuse concerns. We pretty much treat this as a spider web of supports that are throughout the communities, throughout the region, and the whole province wide. When we address elder abuse, collaboration is key for these conversations to continue. Goal number 4 is protective laws and policies. So everyone has the access to legal tools that help protect older adults from abuse and fraud, effectively addressing abuse situations and protecting our seniors' rights. Regular review of legislative frameworks to ensure that they accurately reflect the growing older population and ever-changing needs. There are limitations for each protective law or policy. Participation and adherence from everyone is strongly supported. There are various laws that we have as a province. There are several that are key ones for older adults, like the Protection Against Family Violence Act. This act is a law in our province that protects all family members who are victims of family violence. The act provides authority for the court to grant a protection order where it has been determined that violence has occurred and is likely to occur. Power of Attorney Act. This act allows everyone over the age of 18 to prepare a power of attorney, which is a legal document where the person authorizes another person to act on their behalf for financial and property matters. Personal Directives Act sets out rules governing the appointment of an agent to make personal decisions on an individual's behalf in case they become unable or unfit to make those kinds of decisions. The Act provides details of who can make a personal directive, how it must be written, and what information must be included. There's the Adult Guardianship and Trustee Act, which is a range of decision making for adults who require assistance or who do not have the capacity to make personal and financial decisions for themselves. It also sets out legal requirements for supportive decision making, co-decision, guardianship, trustee, and specific decision making. There's the Clare's Law Act, which is a 24-hour help for people at risk. They can find out if their partner has a history of stalking, harassment, breaches of no contact orders, other relevant acts, or if they have a history of previous abuse. Police will inform the person at risk so that they can make an informed decision about their safety. The application itself takes approximately 30 minutes to complete. Mental Health Act, if you temporarily do not have the capacity to make your own healthcare decisions, someone else might be given the authority to make those for you, such as personal directive. This is the same for the power of attorney. It can come into effect when you do not have capacity, and then it could be revoked when you do have capacity. The person or people you designate to make these decisions must make the decisions based on what is best for you and what you have communicated about your wishes, such as what Charlene said. It's very important to have these conversations, hopefully at 18, so that everything you want is in place for if you lose capacity at some point. There is the Protection for Persons in Care Act. This act provides safeguards against abuse for adults receiving services from publicly funded care agencies. The act creates a duty to report the abuse. And we will go to the next slide. I think I've talked enough about acts. We're going to talk about the prevalence study. So as Joanne previously mentioned, the government is currently underway with this. The previous one was in 2015. The GOA partnered with the National Initiative for the Care for the Care of Elderly, I cannot say that properly, to study the mistreatment of older adults. In 2015, the key findings were the mistreatment of older adults in our province was 8.9% compared to the Canadian rate of 8.2. A history of abuse is one of the top 5 contributing factors of elder abuse, along with having a higher depression score, unmet needs of your activities of daily living, and you not feeling safe with those closest to them. Some interesting points that came out of this was 86% of responders would be very or somewhat likely to contact other family members to seek help. At least 70% of responders would also connect with the police or doctor. Those who actually have sought help from family and friends brought up a concern of someone else rather than themselves. And when the people responded actually sought help from a professional person in office, 30% spoke about themselves compared to 60% over the phone. I find these points very interesting because our case managers have seen a different number of people coming through the door and accessing help. So I'm very interested to see 2015 to now, since there has been fantastic work being done, but yet there's still some education pieces about that abuse is in communities, abuse is happening. We hear day in, day out, nope, not here, not happening here. However, there was a lot happening behind closed doors that we need to break down that door and seek some support from. You can go to the next slide, please. So the power of attorney review, although there is current legislation surrounding what can happen and what cannot occur in our province, there are still several concerns with the current legislation. In 2022, the AEAAC, along with its partners, launched a questionnaire for service providers to understand the concerns around power of attorneys. Our service providers in this questionnaire, 85% encountered issues, concerns, or challenges with the current POA Act and legislation. Respondents were 41% from urban centers and 36% were from small cities and towns. The top concerns identified were the decision making that was not in the best of the older adult, POA using the older adult's money for their own use, neglect of the POA's duties and responsibilities, difficulty in reporting the concerns about the POA, having to go to the court, and maybe that organization doesn't have that capacity or those resources to attend court or even present it at court. There is a lack of accountability for that power of attorney, and there is no standardization of the documents and procedures. Just like the personal directive has this, the POA doesn't. A shocking stat is that 19% of responders encountered challenges or concerns with power of attorneys over 20 times in 1 year alone. That's 19% of people who responded. Over 20 times there's been challenges with power of attorneys. Yeah, we can switch slides. I covered all that. Thank you. And right now, there are several partners gathering with members of the AEAAC together to come up with a strategy to collectively partner with the GOA and get a legislative review done on the Power of Attorney Act. So this is something upcoming that we're hoping to create change on and get some more standardization on. So keep watching for that. Can change now, please. So these, I just wanted to highlight, if you don't have an elder abuse case manager or a CCR or a community organization who responds to abuse of older adults, there could be funding opportunities for you through the GOA, through the AEAAC as well, different community organizations that fund different programs, the FCSS programming in your community or the AA, New Horizons for Seniors, and of course, the Healthy Aging team is delivering great things, so there could be opportunities for some elder abuse components there. You can change slides, please. So these are our resources. I just wanted to highlight a couple of them. So the first one is the info line, the 310-1818. It's available 24 hours a day, 7 days a week, 170 languages, and you can call or text. The protection for persons in care reporting line is protection for those vulnerable adults in care. It's the #1 priority of this line. And it required, like the Protection for Persons in Care Act, as previously mentioned, requires the reporting of abuse and promotes the prevention of abuse from people who are receiving publicly funded care or supportive services. The PPIC Act requires service providers to take responsible steps to protect clients from abuse while providing care or support services. Abuse under this act is an act or a mission that causes seriously bodily harm, emotional harm, results in the administration, withholding, or prescribing of medication for an inappropriate purpose, resulting in serious harm, subjects an individual to non-consensual sexual activity or behaviors involving misappropriating or improperly or illegally converting a significant amount of money or other valuable possessions, failure to provide the adequate nutrition, medical attention, or other necessity of life without valid consent, the individual involved in any person who allegedly abused a client or who allegedly failed to prevent abuse of a client. The client must have been receiving care or support services from a publicly funded provider, such as hospitals, seniors lodges, supportive living care settings, mental health facilities, shelters, group homes, or addiction treatment sites. The Alberta Supports Contact Center, option #1 is for older adults to call themselves. Option #2 is for emergency supports if they need something quite quickly. Or option #6 is for you as an organization or an agency to phone in and support your client with any need that they have. Office of the Public Guardian and Trustee is a you can only leave your contact info and the reason for calling, and a staff person will call you back. And some other supports to consider in your own communities are shelters, hospitals, ambulatory care centers, various medical teams, Alcoholics Anonymous, Al-Anon, the abuse helpline, sexual violence one line. That phone line you can call or text. Then there is a specific helpline for men, and there is another one for mental health. And then 211 is a provincial-wide resource. 811, I really like that it has HealthLink and Dementia Link in there too. And then us at the Alberta Elder Abuse Awareness Council, along with Joanne, we are hopefully that one-stop shop for elder abuse to get the knowledge, the awareness, to get directed to somebody in your community. If there is an elder abuse case manager or team lead or an organization and you want to provide the info to us to share as a resource on our website, we're happy to do it. It has access to training on there that It's Not Right information. We do that World Elder Abuse Awareness Day toolkit, which has everything you need leading up to June 15th is stored on there, plus previous toolkits too. We are annually updating that toolkit to change the content and hopefully increase the different things. We love to hear from you, communities, on what you need in elder abuse, not just on June 15th, but every day. If there is any resource or support or question that you may have, Joanne is happy to answer that or share out your contact info, whatever you may need. So thank you.
Thank you, Brittany. I appreciate that. Thank you to all of our presenters today. Is there any questions? Jane, do you have any questions if you're available at the moment?
Yeah, so there's a couple in the chat box here.
Amanda, do you want to take off the, thank you.
Yeah, you bet.
So would there be data disaggregated to show abuse statistics, barriers, and outcomes for rural and new Canadian seniors? Also, if there is information for senior women who experience both intimate partner and intergenerational violence? And what are some current challenges and solutions with outreach into immigrant communities to talk about senior abuse?
I can start us out with that. So currently, the Alberta Elder Abuse Awareness Council, under our grant funding, is collecting stats about how many seniors, older adults, are experiencing elder abuse. So the slide protection took a look at spring of 2022. We are breaking that down, and that was a 6-month snapshot. We will be looking at a year, and that will happen within the next couple of weeks. Our stats data collector will put it up on the website so that you can take a look. Previously, we had in Edmonton a case manager who was working with our East Asian community. At this point in time, that has shifted, and we're looking more at providing information and education in those communities. We do hope to do a bit more breakdown. We do know in these communities that we're providing support services to, Calgary and Edmonton are there, but we also have 2 First Nations communities. So we have Enoch and Siksika, who are a part of the grant funding, and all those other communities are rural and remote communities. So that is starting to collect those pieces of information. We're working on getting more detailed information with the surveys that we're collecting. I don't know that we've got to where we need to be, but it's certainly a stat that we're looking for in the suggestion about couples and rural communities and with older women. I will take a look at the question and see if those are pieces that we might be able to look at stat collection along the way. So thank you for the question.
Okay, Kelsey, question. I know BC allows trained assessors, nurses, social workers to investigate complaints of financial abuse for elders. Is there or will there be anything similar in Alberta?
So Joanne quickly answered that there are several case managers throughout the province. However, there are community organizations who have the elder abuse component on their plate too, that are in FCSS offices, social workers in communities, hospitals. They do it. However, there are a nice, beautiful, small team of dedicated case managers. So depending on your area, if there is a case manager close, we would definitely refer to them, as they can supportively support them through that process of going through all the concerns needed to be addressed.
Thank you. Another question, is anyone dealing with systemic abuse or institutional betrayal?
When I think of those systemic issues or the institutional betrayal that's occurring, I look to SHIFT, the University of Calgary, who's looking at those upstream issues and looking how abuse was perpetrated and ways to be able to circumvent some of those issues that were happening along the way.
Anyone else have any questions?
Charlene, do you happen to have, I can't remember if your slide, if you had the information to that shift, or if they can just go to University of Alberta?
Yeah, if you actually, if you just Google shift and domestic violence, all in the same Google search, their information will come up. And there is a lot of information in there. Just like Joanne had said, I think that, and unless I'm misunderstanding the question too, and forgive me if I am, I think that there's a lot of work that needs to be done with regard to what's happening within our facilities, that where seniors are residing. And so COVID has certainly shed some light on some of the gaps and barriers and challenges that are faced within not only our province, but across the country. And I think those things have to be talked about at some level, in some capacity. And certainly those kinds of situations, for me anyway, as a case manager, they do come across my desk. And those are the situations where I bring in the other supports within our coordinated community response to help brainstorm the best approach to take when there are situations where abuse is happening within a facility. And certainly having conversations with the people from the PPIC, the Protection for Persons in Care, are wonderful collaborators when it comes to helping assist people in those situations. I'm not sure if that's what the question really was leaning towards, but there's a lot of work still needs to be done for sure.
Okay, a couple other questions. Is there a list of communities that have case managers, or how would you find out if someone's community has one?
I had just put in the box to go to the Alberta Elder Abuse
Okay.
Awareness Council website, and it has the list of the communities that are involved currently. So like I said, there's 13 that have been grant funded. Our hope is within the next 2 years that we're adding 10 new communities. So part of that work is being done now, exploring with people who had between 2015 and 2018 a coordinator at that point in time, but it doesn't necessarily have to be. If you are looking or interested in developing a coordinated community response, please send an email through, and we certainly can give you the information that is needed. And I'd be happy to chat with anybody who's interested in putting together a coordinated community response team, or interested in the grant funding that's coming available next year.
Thank you. Is there free legal consultation for seniors with low-income families to discuss financial abuse?
Darlene, I'll jump in, but I know we use legal guidance. So legal guidance has 4 locations across the province: Red Deer, Calgary, Edmonton, and Lethbridge, and they cover areas. And so they're not specific to just those communities. They will cover more areas. And there is a threshold, but if you're below that threshold, there's no charge for accessing those legal services. And again, it's called legal guidance, not legal aid. And if you Google them, that will come up.
In Edmonton, we also have the Edmonton Legal Community Council, and they provide free service to lower income adults.
I think if I could also, and I depending on where you live, there are FCSS offices all over the province, and while I don't want to imply that they are all in a position to give, to listen to and give information about financial abuse and to kind of brainstorm with people about what financial abuse is, I think there's a growing number of them who have senior support workers who might be able to sit down with families who are low income and have those conversations and navigate those conversations with them without giving legal advice. I think that there's a misperception all over the place that it's only people with high income and who have means and wealth who are financially abused. And that's one of those stereotypes that we see within the elder abuse world, that it's not just people who have high incomes and great wealth who are financially abused. People with very low income can also be subjected to financial abuse, which can be actually have a lot more impact than people with great wealth.
Yeah, and I noticed that there was a couple of comments. I think it was Kelsey mentioned about asked about or Kimmy about the Calgary the elder abuse response team through the Calgary Police Service, and I believe there's also one through Edmonton. The big cities luckily do have those where there's a team that can respond. And when you're looking for your rural areas, it's the case managers or the folks that have the CCRs, because oftentimes the victim services or the RCMP are sitting at those community coordinated responses, and so they come together as part of that to work on or help the case managers or the communities with those extremely they're delicate, and there's lots of different angles and fingers that are out there of how to help folks that are in rural, unfortunately. So that's the great thing about the CCRs and the case managers, is they are working together in those smaller centers to support our folks that are struggling or needing help in the premise of the elder abuse information and how to get help. So very, very good place to go. Oh, and Joanne has just added some of those areas.
Sure,
so that's great. Yes, thanks, Joanne. So if there isn't any more questions, thank you so much for joining us today. Oh, go ahead, Brittany.
We get to those questions that were sent in on the registrations.
Oh, yes. Let me see if I can find that. So there was a couple of questions. We had one that, and I don't know if we'll be able to answer this, but what if a POA does not follow the directions in that document? And that was from Westlock, Linda. I don't know if Linda's here, but does anybody have, I know we spoke about that, and so there's maybe some direction from that information on, and some work that's being done to support those predictions of care or power of attorney. I know, Brittany, you had mentioned that there was some work being done on that. So hopefully that answered your question as to where we can get in regards to power of attorney.
I have a quick questions regarding the power of attorney.
Sure.
Because I seen that many families they can't afford. So when it comes to price, 2,000 and around 2,500, so they can't afford it. So as a social worker, we just reminded them it's important document. They know that, but when it comes to finances, it's hard for them. So is there any way we can advocate on that, so that way they can get free legal services, or maybe lower rate some way?
Sorry, we have certainly found the exact same things, that people across the province are not able to come up with $2,000. There's possibilities of approaching lawyers in your community to see if there's any kind of pro bono work that can be done. I know it's an element that came up at our Power of Attorney Committee meeting that talks about the average senior who is of a lower socioeconomic status cannot put out $2,000. They just can't. And so one of those things are put forth with regards to how can we make this different. We do know that with personal directives, they can do that piece online. It still is encouraged that the POAs be done by a lawyer, just in case there's any dispute with any of those things. But I guess I would say duly noted that we certainly see that as an issue for seniors across our province. Charlene,
I think,
Teresa?
yeah, if I could just add to that too, I think, and I agree with Joanne, I think as a case manager, I tend to look at the family dynamics as well. And so if you're looking at a situation where there hasn't historically been, a lot of family conflict, and it seems like a pretty easy, there's not a lot of assets there that have the potential to be misused. You can suggest that people go to their bank as well. Banks will all work through, in fact, a lot of times I see where banks will insist on having a separate banking power of attorney document in place besides the legal document that people pay for with a lawyer. So that's a strategy that can be used too, that depending on the needs of the senior, just going to the bank and having the power of attorney, the banking power of attorney drawn up there as well can sometimes be helpful, and that's a free service for people.
Thanks, Charlene. So thank you for everybody's input today and for all your questions. We will be, I have a note here just to read it from Aaron. Today's session will be available on the Core Alberta website and also on the Elder Abuse Group's playlist. The Core Alberta has a YouTube channel, so you can get this one as well as some of our other ones that have been done in the past that we've put quite a few out. So you're welcome to have a look at those. We also will be sending a survey, and we would love for you anybody to comment or have any criticism. What's the word? Not nicely.
Gosh, don't ask for criticisms.
Sorry.
Back.
Yes. Any suggestions that you may have as to how to make our presentations better? We would love to have your input. And again, thank you so much. We appreciate you. And like I said, any questions, you probably can just send. Oh, and Aaron's put a fill out now or fill out later. So if you want to click on that right away so you get it done before you leave, that would be great. Thanks, Aaron, for keeping us on tap here, able to keep up with the times. Yeah, again, thank you. Goodbye for now and hope to see you soon.